A chance to save a life could come when you least expect it. So why not prepare yourself for that possibility by learning CPR? Fort Worth Medical Center's Dr. Curtis Sandy is joining us this morning to talk about the CPR demonstrations that will be going on at Costco tomorrow. And then Nikki Goldag, the community education coordinator, is joining him to show some of those demonstrations as well. So thank you both so much for being here this morning.
Thank you for having us, Brandy.
All right, so let's get started. CPR, I actually don't know CPR, so I think this is a perfect segment, and I think that it's great that you're doing that tomorrow at Costco, because I think there are a lot of people who don't know or wouldn't know what to do in a situation like that. So tell me a little bit about a situation and when CPR needs to be performed.
CPR has been around for 50 years right now. We just celebrated the 50 years last year. And like yourself, many people either have never had training or they're afraid to perform CPR. You know, CPR is really the intermediate treatment or that is needed for patients in sudden cardiac arrest. That's a condition when the heart stops suddenly and they go into a rhythm that doesn't perfuse blood. And so the only way to get that heart back into a rhythm is to shock them. You see that on TV all the time, clear shock. And in the meantime, until you can shock them, we need to try to perfuse and move that blood around to keep the brain functioning. CPR is the way to do that.
Okay, so if I was in public and saw somebody having, like, what would be the symptoms of me knowing I need to do something like that?
Usually the patient will collapse suddenly.
Okay.
They may look like they're gasping for air, trying to struggle to breathe. They may actually have seizure-like activity and shake a little bit, but they will ultimately become unconscious and completely unresponsive. They'll start turning gray or a blue color, and at that point, before the focus has been on the mouth-to-mouth and doing the chest compressions, very few people wanted to do the mouth-to-mouth, especially to strangers.
Right.
What we have found over the years is that the mouth-to-mouth really doesn't matter that much anymore, and that just pushing on the chest to circulate the blood and the oxygen that is already in the blood is really life-saving.
Absolutely. And Nikki, you are actually going to give us a demonstration. Being the coordinator, the education coordinator, does it seem like a lot of people out in the community don't know how to do CPR, and it is very important to do these things at Costco that the hospital will be doing?
Yes, we offer classes every month at the hospital, so whoever's interested can sign up for those classes. We offer a few different types of classes depending on what type of certification you need or what you're looking to learn.
Okay.
But we fill up our classes usually every month, so there's a lot of people out there who are interested and look for those certifications. But we will be at Costco tomorrow from 10 to 2, and we'll be there demonstrating. We'll have lots of mannequins for people to practice on, and we've got t-shirts and great giveaways for everybody to come out and check it out.
That's great. So we are out of time, but I'll have you do a couple of compressions, and I'll also have you tell the viewers what's on the t-shirts, because I think it's hilarious.
You can tell them about the t-shirt.
The t-shirt, and we're remiss that we did not bring one, but the basically has a big X in the chest. It says push hard, push fast. Push here, and then push hard, push fast.
That's great.
So,
well,
as you'll see, Nikki simply puts both hands in the center of the chest, pushes down with straight arms, pushes about 2 inches, rate of about 100 a minute. If you think about the song Staying Alive, row, row, row your boat, to keep that rhythm.
Well, thank you so much, Dr. Sandy, for being here. Nikki, we really appreciate it. And again, at Costco tomorrow.